Welcome back. Now that a majority of Americans ages 18 and older are fully vaccinated and restrictions are being rolled back, 66% of U.S. adults say their lives are somewhat or completely back to normal. And those numbers may grow in Illinois as the state makes that transition to phase 5 and fully reopening on Friday. Joining us to discuss more is Dr. Shikha Jain with University of Illinois at Chicago. Good morning to you. As always, nice to see you. So the state is fully reopening on Friday. So what exactly is this going to mean for social distancing, mask mandates, business capacity rates? Do you think we're going to see a huge difference?
I think we will start to see a little bit of a difference. We're still recommending that people who are not fully vaccinated wear their masks when they're indoors, especially. So if you're not at least 2 weeks after your last dose of your vaccine, those who are still not fully vaccinated need to be wearing their masks. But if you are fully vaccinated, there will be abilities to go inside, to not wear your mask, to socialize. Businesses are going to be reopening. There aren't going to be capacity limits. We are, across the board still recommending that if you can distance while indoors, that's ideal, but there will be no capacity limits. There will be some businesses that still require masks for everyone, things like public transportation, airports, hospitals, clinics, some long-term care facilities, places where people are really close together. There will be some places where masks will still be required for everyone, but for the most part, if you are fully vaccinated, you should be able to move around without a mask for the most part.
Okay, so now that we are reopening, we just had announced today that our positivity rate is at 1%, which is the lowest it's been since this started. So what is this going to mean when we fully reopen? Do you think there's a likelihood we're going to see that rate go back up again?
I think there's definitely a chance where we start to see numbers go back up again. We know that human nature is such where as we start to remove restrictions, people get a little bit more lax, people get a little bit more complacent. And again, we also know that the entire community in Illinois, the entire state is not vaccinated. So there are still a significant number of people who are unvaccinated. Plus, we have children who aren't eligible for the vaccine yet. So I can imagine that numbers would start to go up slightly, hopefully because we will continue to increase the number of people vaccinated. We won't see those big surges that we've seen in the past. But again, it's really going to be on us as a state and as a community to make sure we're all getting fully vaccinated so we don't see those big surges.
Okay, let's talk about those children who are underage and have not been vaccinated. Do we still need to expect them to wear masks because parents are looking at going to summer camps and sending them out? Should they be wearing masks?
Absolutely, 100%. If your child is not vaccinated yet or they're not old enough to be vaccinated yet, they should definitely be wearing masks. I think I've told you before, I have 3 kids who are 7, 3, and 3, and the 3 of them are still wearing masks. And they actually remind me sometimes that they need to be wearing masks because they are so responsible and they've gotten so used to it. So until they are able to get fully vaccinated, they are still at risk for developing COVID and contracting COVID. And then they're at risk for passing it on to other people. So if you have a child who either is not eligible for the vaccine yet, or you haven't been able to get them a vaccine yet, 100% they should be wearing a mask.
Okay, and it's going to be a hot summer. It already is, so that's going to be interesting to see. Okay, let's talk about this Delta coronavirus variant that was first identified in India is now said to account for more than 6% of the cases here in the U.S. How deadly is this, and should fully vaccinated people be concerned?
So there is definitely data that shows that the Delta virus is much more contagious and much more transmissible, meaning it's much easier to pass from person to person, and it is much easier to pass from person to person. There's some early evidence that it's also much more dangerous and it could potentially be more deadly. The biggest concern with this is because it can spread so quickly and because it can spread so easily, those people who are unvaccinated will be at higher risk of contracting COVID-19 if they come in contact with someone who has this Delta variant. And then the second concern for those people who are vaccinated is while, yes, the vaccines that we have now are effective against this particular variant, after you've gotten 2 shots, we know that after 1 shot, you don't have as much protection. You only have about 33% protection against this particular variant. And if this variant continues to spread amongst the unvaccinated population, there is a risk for new variants developing. And eventually we may see a variant that our vaccines are not as effective against. So that's why we need to really get people vaccinated vaccinated and stop the Delta variant from spreading across the country so that we can prevent new variants from coming out that may eventually be able to get around our vaccines and put even the vaccinated at risk in the future.
Okay, let's talk about people who have already had coronavirus and have not been vaccinated. A lot of them are questioning, do I really still need a vaccine because I have the antibodies?
That's an excellent question. So once you get a virus, you do develop some antibodies and you have some level of natural immunity. What we have found with the COVID-19 virus is the natural immunity that you develop after contracting the virus is not as high as getting the vaccine itself. So even if you've gotten COVID-19, the virus, if you've been infected, if you've been sick with the COVID-19 virus, you still need to get vaccinated because your natural immunity is not going to protect you as much as the immunity you will get from the vaccines. And especially with these new variants, you need that added level of protection to make sure that you're as protected as possible. So if you've had COVID-19 before, you still 100% need to get your vaccine, and you need to get both doses if you're doing Pfizer or Moderna. You need to get one dose if you're doing Johnson & Johnson.
Okay, Dr. Shikha Jain, as always, we appreciate your time. 1%, wow, we have come a long way, haven't we? You've been with us from the beginning. So thank you so much for your insight and perspective. We always appreciate it. Have a great day.
You too, Sylvia.
Coming up.